mission. All you verses sound like dirty dishes. I'm about to clean them in the kitchen. And we making. Hey, what's going on, you guys? This is Madam, and I am back with you again. Back to the usual, regularly scheduled program with my content. This article is by CNN.com, and it says Montana nursing home turned down free COVID testing. Yes, free COVID tested. Now, almost every resident is infected, and 8 have already died from COVID-19. Okay? In the subcaption, it says at least 55 residents and 36 staff members at the Canton Creek Memory Care Community in Billings, Montana, have tested positive for COVID-19. 8 have died. The article starts off by saying an assisted living facility in Billings, Montana, was offered free voluntary surveillance coronavirus testing for residents and staff by the state of Montana in June, but declined, health officials said. Now, almost all the residents and some of the staff at Canton Creek Memory Care have COVID-19, and 8 residents have died of the disease, according to officials. On June 30th, a resident of the Canton Creek began to show symptoms of COVID-19. Chase Slayer, a spokesman for Qualosh, I apologize if I messed up their name, Senior Communities, the company that runs the facility, told CNN after the person's test came back positive, the facility tested everyone on July 3rd, Slayer explained. Those tests revealed that of the 59 Cannon Creek residents and 55 staff, 43 residents and 15 staff members tested positive for COVID-19, the company said last week. The numbers has since grown. At least 55 residents and 36 staff members have now tested positive. Pat Zeller, a spokeswoman for Riverstone Health, said Yellowstone County's Public Health Department, it's Yellowstone County's Public Health Department. That's what they told me to CNN. As of Tuesday, 8 residents have died of the disease, Zeller said. 2 of those deaths have occurred since Sunday. The facility was offered free tests by the state of Montana in June 16th. Slayer confirmed. However, Slayer said the state's testing program would not actually have tested all the residents, but a limited sampling of individuals within the community. Moreover, since the beginning of the outbreak, residents in our community were already being tested, and all of those test results were negative, Slayer added. Any of our residents who displayed symptoms since the outbreak started were being promptly referred for testing, Slayer said. The state of Montana has reported 36 deaths due to COVID-19 to date. According to the state data, Yellowstone County accounts for 13 of those deaths, according to the Riverstone news release. The 8 deaths at Cannon Creek make up almost 25% of the state's total death and more than 60% of the county's death toll. COSAC Senior Communities ran more than 35 facilities in 8 states across the country, according to the website. So, they were already being tested, if that's to be believed. And I'm just saying, hypothetically, If that was to be believed, that they were already getting tested and they had came up negative, what happened between the time that they were coming up negative to the time that they were offered the actual test? Regardless if it was going to be limited, you already said that they were already being tested. So why wouldn't you just get extra testing to, be on the safe side and stuff like that? Why would you turn it down? I don't understand. It doesn't make sense to me, because if they were already getting tested and they came up negative, then you were offered tested in limited capacity. Regardless if it was in limited capacity, it was still more tests on hand for you to have. And then you turn it down, and then next thing you know, everybody started popping up with COVID. So I'm not really understanding some of the questions I would ask. Could you trace this back to patient zero, or a person that first developed symptoms? It did say in the article that as soon as they displayed symptoms, that they would be immediately referred to get testing. But you just said that you were already testing and people were coming up negative. Excuse me. So, this is a very interesting story. If you have anyone that lives in assisted living facility or hospice or anything like that, it's definitely not a easy thing to go through, being it's that we're in the midst of a pandemic and that people are dying left and right. It just goes back to a failure, in my opinion, on the state, and also a failure on the government. The government has just literally washed their hands of all responsibility to help states secure testing. But yet, Governor Hogan, when him and his wife secured over 1 million tests for the state of Maryland, people frowned on him. The government had an issue with Governor Hogan securing tests that outside of the United States and stuff like that. That one act that Governor Hogan did, I feel like he saved millions and millions of lives, thousands of lives, that otherwise people would have been left in limbo. They don't want people to test. They want people to go back to school, send their children back to school. They want college students to go back to college. And my whole thinking is, if you love your children, politics aside, if you love your children, there is no way in hell you would find any justification in your mind to allow your children to go back into a public environment where they don't even have treatments. They have drugs that they are testing that are showing promise, but they don't have not even a treatment, not even a guideline. And the guidelines that are being put out by the CDC, again, the government is telling the states to ignore the guidelines that the CDC. It's like it's not only just that they the CDC, like they are the first and foremost defense, along with the World Health Organization, to combat global pandemics. Okay, state, local, nationwide, worldwide, they do this. Okay, so that's what they do. That's their job, and you're stifling them by telling the governors in the states, hey, don't listen to these people, even though they've had years and years of experience and decades of experience dealing in the very thing that we're going through now. I also want to say my condolences to the families and loved ones of the people that are working there, and the residents that are staying there, that they are taken care of. I hope that that situation gets sorted out. But like most everything that's been going on in the past 3 to 4 months, it's a little shaky. And I would like to hear your opinion on it. I would like to know how you feel. Do you have someone or know someone that lives in assisted living facility, or a hospice, or some type of medical facility like that? Definitely would love to hear from you. I would definitely want you to drop down in the comments, and also like and subscribe and share. As always, you guys. Until. I'm the guy that never put you on a stretcher. I am here